Hello everyone, I am Dr. Kunal Mahajan. I am Director Cardiology in Himachal Heart Institute, Mandi, Himachal Pradesh, India. Today I will be speaking on the management of dyslipidemia in patients with peripheral artery disease. Peripheral artery disease is a grossly neglected and under-recognized disease. If you see, we are more worried about heart attacks, strokes, but we are less worried about loss of limbs. And peripheral artery disease is actually very, very common in India. Peripheral artery disease and coronary artery disease, they are actually the two sides of the same coin. If we have done a study in our center and we have seen that those patients who had MI and underwent revascularization for that, we did ABIs, we did femoral plaque evaluations in all those patients, and we found that as high as 70% of these patients had associated peripheral artery disease, and they were asymptomatic for that. So in India, peripheral artery disease is grossly neglected and under-recognized. The main problem is that majority of these patients are actually not coming to cardiologists, or they are not getting evaluated for that. Majority of them are diagnosed to have sciaticas and neuropathic pains, and they are on follow-up with orthopedicians or general practitioners. So that is something which is worrisome. And regarding the role dyslipidemia plays in pathogenesis of peripheral artery is very well known. We have data from Framingham Heart Study, from the Lancet Global Studies, that LDL cholesterol, high LDL cholesterol is associated with pathogenesis of peripheral artery disease, as it is associated with other development of other atherosclerotic cardiovascular diseases. So once these patients come to us, we actually we characterize them as per the LAICON scores and categories, and all these patients are actually classified into very high risk group per se, because they have established atherosclerotic cardiovascular disease. So once this patient come to you, you have to bring the LDL levels down, and statins actually are the cornerstone of this therapy. They decrease the cholesterol levels, as well as they provide some benefits like they increase the exercise capacity, they decrease the amputation rates. These all have been studied, and we have got enough data for that. So once you diagnose peripheral artery disease in a patient, you have to emphasize that patient should stop smoking, he should walk daily, he should exercise as per the recommendations, and vis-a-vis he should take adequate control of his diabetes as well as hypertension part. And because you have to follow a multi-morbidity approach. It's not only peripheral artery disease, everything has to be taken into account. And after that, you start these patients on high intensity statins. Start with say 40 mg rosuvastatin or 80 mg atorvastatin, whichever you feel comfortable. And after that, reassess after 4 weeks. If they achieve targets, that's fine. If they don't, you have to add the other drug like ezetimibe. Again, after adding ezetimibe, just keep on checking. Today is the scenario of evidence-based medicine. We have to be precise. So you have to check it, that LDL levels, whether they are achieved or not after 4 weeks. If the levels are achieved, then fine. If they are not achieved, add other drugs like bempedoic acid or even PCSK9 inhibitors. The target goal is less than 15, all patients with peripheral artery disease. If patients have associated coronary artery disease or cerebrovascular disease, even one of them, then these have higher risk. So in such patients, if patient has polyvascular disease, the targets are even lower. And if patient has diabetes also, then this is actually a malignant form of diseases, which is very common in India. So in such patients, the target should be at least less than 30 milligram per deciliter. That is what Lipid Association of India recommends, and that is what we should follow if we have to curtail this epidemic of coronary artery disease, peripheral artery disease. In fact, I should say atherosclerotic cardiovascular disease in India. Thank you so much. If you like this video, please press the like button and share and subscribe the live television.